have treated areas with stem cells at Hasan surgery from October 2016 to October 2018, where 90 treatments were done. Out of that, the most common treatment was done for the face, including the volume restoration and anti-aging or rejuvenation of the face. Then hair loss for male and female. We did some couple of treatment for knees, and then scars and other indications for stem cells that my colleagues have discussed earlier. We have seen that the frequency of the treatment, the most common treatment that we've done is for face, and the second common was for hair, and then after that, other areas. We also combine stem cells with fat or with the microfat grafting for face. As we know, the stem cells are like a building block, so their indications are multiple. I don't want to bore people with a lot of information. We just discussed the cases that we have done it. We mainly did cases for rejuvenation of the face and hair restoration. We have also tried it for dark circle treatment, for hypopigmentation, hyperpigmentation, and stretch marks in different areas. We still need to wait and see what are the results of that. So if we look at the skin, it depends on where do you inject. So if you need volume restoration, maybe you have to go a little bit deeper. If you need to do some rejuvenation for wrinkles and lines, you may have to go a little bit superficial. So the technique is different for each patient. I always ask the bioscience lab that how many cells are there, in stem cells, because when we do a fat grafting, we do inject a lot of fat for volume restoration, for example, buttocks augmentation or breast augmentation. I've been heavily involved in fat grafting for the last 12, 13 years, and only recently, the last 2 years, I have started adding stem cells into it, so I don't have a big data for that. But definitely the results are very promising when you add stem cells, and I agree with my colleagues who presented earlier than me. So the percentage of stem cells treatment that we combined with different treatment, for example, along with Botox or microfat grafting, or just a simple fat grafting, or there's no combination in over 90 treatments. The new combination was about 57%, and the most common combination was for the face treatment along with the fat, microfat or nanofat, along with the stem cells for face. Now the overall the satisfaction is, we still need to divide it more than how much they are satisfied on the scale of 1 to 10. But we do have an order system where the clinic is fully, completely paperless, and all patients who checked in, they automatically have to say if they are satisfied with treatment or not satisfied with the treatment. So initially, the data that we have it for satisfaction of the patient is quite encouraging, up to 69%. We still have a lot of no-shows that we don't know. The patients have not come back to us and did not report anything that either they are happy or not happy, we don't know. We're still trying to contact them, and some of the patients have turned off after 2 years, and we know some patients are not happy. They just don't want to come back, and they bluntly say that it didn't work for me. Obviously, for each areas we have divided it. That for hair, it's a big classification. What are the problems for the hair? As my colleague discussed from Kakuna, that there are so many. The commonest problem for male hair loss, the androgenic alopecia, which is the most common patients that are coming to us for hair restoration. The results that I have seen with stem cells, the best results is in the female rather than male patients. So all of our unsatisfied patients are the male patients that we purely did stem cells and no other treatment with that. So our hair treatments are mainly those who have not done hair transplant, they have not been treated by anything else, and I have mentioned to them that if they are doing stem cells, they can't do anything else, so that we know if it is really working or something else is working. So I think this is again difficult to control, but probably if you really want to know if the stem cells really help in hair restoration, you need to really isolate them from other treatments. The face treatment has very good result, and we have some patients that have not come back to us, but They're quite satisfied with both kind of treatment, either it is for scars on the face or wrinkles, lines, deep nasolabial lines or laugh lines, which we call it. So these are the treatments we offer for patients. Of course, there are so many other treatments that can be done for rejuvenation, including hyaluronic acid treatment, PRP or PRP with hyaluronic acid. So I think other studies needs to be compared with this in order to find out if this is any superior to anything else. Now, for all the scar treatment that we have done, we have almost 100% satisfaction. This is very encouraging to see that all patients were very happy with the treatment. The other very challenging thing is about the cost of the treatment. Obviously, the cost is quite high for these kind of treatment, and therefore we do not get a lot of patients who would like to do this because they get an offer for other treatments which are much cheaper. So we have to have a significant improvement in order to